Good evening, everyone. My name is Olivia. I am the Digital Communication Specialist for Grey County, and I'm here today to facilitate this long-term care call. With us today, we have our Director of Long-Term Care, Jennifer Cornell, and we also have Dana Leach. She is the, hi, she is our clinical specialist for long-term care. We are going to run through a couple things before we get started, just so everyone is aware. So I'm going to share my screen. Let's see. Over here. There we go. Okay. Okay, everyone should be able to see that. So today is Thursday, June 10th, 2021. There we go. This video discusses matters related to residents of long-term care homes operated by the County of Grey during the COVID-19 pandemic. Please feel free to share this video with others in the Grey County community. If you have a family member in a long-term care home not operated by Grey County, please contact that home if you have questions or concerns about their care. All right. So just a reminder before we get started, we will be funneling all questions through the Q&A chat. You can find this if you have a desktop or a laptop at the bottom of your screen. Please feel free to put any questions in there, and we will be going through them after Jen's update. We can continue working through that until approximately 8 o'clock tonight. If it goes a little bit longer, that's okay, but we're going to try and stop at about 8 o'clock. If you do use a cell phone to watch the Zoom video at all, you can find the chat, only the Q&A feature at the top of your screen, okay? I'm going to pass it on to Jennifer now, and we can get started.
Great, thanks so much, Olivia. Can you hear me okay? Yep, okay, great. Thanks, well, good evening, everyone. I do have an update, and it's been a while since we met, so there's a lot to share, so I will get right to it. We met last virtually on March 16th, so I can hardly believe that it's been a couple of months since we've pulled together and provided a virtual update. All of our residents that wish to be vaccinated are fully vaccinated, and we're going to talk a little bit later about some vaccine updates. As of today, there are no cases of COVID-19 in either residents or staff at our 3 homes, and there are no long-term care homes in outbreak in Grey Bruce. The purpose of our call tonight is to provide an update and just go over the changes, and there are lots of them. So during this call, we're going to provide an update on the updated directives, the visiting guidelines, and step 1 in the roadmap to recovery. I'm going to provide a vaccine update and talk a little bit about June is Seniors Month. So there has been some changes to our kind of standard strategies that are in place, so I'm going to go over them quickly. We do continue active screening for every person who comes in the building. Screening on the way out is no longer required. And so this is every team member, service provider, and every visitor, essential visitor, and soon other general visitors. This active screening includes documenting name, contact information, and answering those specific screening questions. And then we have staff there to support PPE, hand hygiene, tips and strategies. Staff are only working in one facility unless they are fully immunized, and then they're able to work in more than one location. And this is something that we keep track of and make sure that there's a good understanding between us and the team member and their other organization that they work for. Rapid antigen testing continues for all staff and DCPs. We do continue to minimize the movement of staff from home area to home area within the home, although there is some relaxing around opportunities for residents to gather together in cohorts in the home areas, and we're going to talk about that a little bit later. All staff and visitors in the home continue to wear surgical masks at all times, and plans continue to be in place to quickly isolate residents if needed and to move in quickly into a full outbreak protocol if we need to. And we continue to monitor our PPE supply, and we report that inventory to the province regularly. So updates to the directive, visiting guidelines, and step 1 on the roadmap to recovery. Over the past few weeks, the Ministry of Long-Term Care has announced changes to support resident well-being and enable family and friends to connect with their loved ones. And I'm now just going to be reading directly from their most recent memo. These changes were made in anticipation of step 1 and include allowances for the following. So outdoor visits, including 2 general visitors and 2 caregivers, was effective Saturday, May 22nd. And then effective yesterday, the outdoor visits have been extended to support residents who are not able to do an outdoor visit. So for residents with mobility limitations or health conditions that make outdoor visits highly unlikely or very challenging, then an indoor visit that can include 1 general visitor and 1 DCP can be arranged. So we ask that you contact the Resident Family Services Manager to make that special arrangement. Since we're talking about visits, I just wanted to remind all visitors and DCPs that while you are able to bring food or a drink for your loved one, unfortunately, you still aren't able to eat together. So don't bring yourself a snack. I hope we get there. I know we will get there, but for now, the resident is able to take their mask off and enjoy a beverage or a treat, but you both can't do that at the same time. So then back to the provincial changes. Social day trips and temporary overnight absences for fully vaccinated residents are now permitted. We ask that you contact the home to make arrangements for an overnight absence. There is still a requirement for residents who have been away overnight to have a PCR COVID test and isolate until those results are back. So give the home a call and we can support the discussion and the decision about an overnight absence and exactly what that looks like and how it works. This was very welcoming news, although our 3 care communities already had provisions in place for a brief hug. So regardless of a resident and visitor's vaccination status, brief hugs can now take place. Where both the resident and the visitor are fully immunized, close physical contact, including hand holding, can now take place safely. It is important that residents and visitors continue to adhere to public health measures in the home, including good hand hygiene and appropriate masking. And I'm going to go off my notes for a minute and just share that Ontario Health and the Ministry of Long-Term Care have held some very large virtual sector meetings for long-term care leaders to attend, and they give an update on what's going on, but they also give us an opportunity to ask questions in similar to this format. And there's been a lot of advocacy from long-term care leaders across the province about the importance of physical contact, close contact, hand holding, hugs, social contact. And I'm really heartened to see that being addressed in directives from the Ministry of Long-Term Care. So it's good when we have a voice and we have an opportunity to advocate for what's important. The memo goes on to state that additional changes will not be introduced with the move into step 1 under broader provincial reopening. So there was some concern or wondering within the sector that this information all came out kind of last week and in the last few days. And so when the province moves into step 1 for reopening more broadly, would there be more changes coming? And so what we've heard from the ministry is no. All of the changes that have been made now were done ahead of time in preparation to align with step 1. They do note though, and clarify regarding small group activities for residents. So as per the Ministry of Long-Term Care guidance documents, small group activities among residents may occur inside with residents cohorted and masked where tolerated. Masking is also required for staff and any fully immunized caregivers who join the activity. They have not assigned a specific number of a group size, and it will vary based on the size of the cohorts that each home has created. So they have updated the guidance document to recognize that small group activities may also occur outdoors with the same precautions. They note any group activity taking place beyond the home's property would be subject to the social gathering rules set out in the broader provincial reopening plan. So we could have a small group of people, residents following these rules on our property, but if we are going to a park, then we need to follow the provincial rules. So I think that's also good news in acknowledging that is something that's really important to our residents. Vaccination update. We continue to work closely with our partners at Grey Bruce Public Health in providing vaccine to all of our residents, new staff, new DCPs that would like a vaccine. On May 31st, the Ministry of Long-Term Care released a new directive that outlines all long-term care homes are required to have a COVID-19 immunization policy in effect as of July 1st. Vaccinations are a crucial part of the road to recovery. High rates of vaccination in our care communities are important to protect all people who live, work, and visit our care communities. Vaccinations also help reduce the risk of outbreaks and the need to isolate residents. And we know that isolation means residents lose in-person social interaction and the ability to engage in activities. And the effects of isolation may be greater for residents who have dementia and/or cognitive impairments. The objectives of the directive are to set out provincially consistent approach to COVID-19 immunization policies, to optimize COVID-19 rates in long-term care homes, and to ensure that individuals have access to information required to make an informed decision about their COVID-19 vaccine. The immunization policy will require all persons, so that's staff, students, and volunteers, to select one of the following options. They must provide proof of a vaccination against COVID-19, or provide written proof of a medical reason for not being vaccinated against COVID-19, or complete a COVID-19 vaccination educational program. Our team is busy working on developing the immunization policy and education program. And there is a desire with our colleagues locally in Grey Bruce and across the long-term care sector more broadly to have a consistent approach to this program. And so we're working together to have some consistent messaging and requirements in those policies. Currently, our vaccine rates are still looking very promising, and I need to make this bigger so that I can see it. I maybe should have popped my glasses on. So our resident rates of second dose are between 93 and 98%, so fully immunized. Our rates of first dose for staff, so we have between 72 and 80% of our staff have had their first dose of vaccine. And our second dose of staff is between 65 and 69%. So we're getting there, and we're doing a lot of work in providing information and making sure that people have the access to the vaccine and information and the questions answered so that they can make an informed decision. Just want to give a shout out to the DCPs, so the designated care partners. Our DCP group, which is almost 400 strong, has a first dose rate of 73 to 95% and second dose rate of 67% to 95%. So awesome job, DCPs.
Hey Jen, sorry.
Yes, yep.
Just making sure, would you like to share your screen to show these items at all?
Sure, I'm going to show a poster actually, and I'm just going to open it up. Here we go. So I'm going to share my screen because another initiative to support vaccine confidence is highlighting team members' reason for why they got their vaccine. So let's see if this works. Can you see that, Olivia?
Yes, that's great.
Yeah, so each care community is working with their team members to put together a poster that actually there's going to be 3 or 4 posters. We can make as many as there are people interested and willing to have their picture taken and share their reason. And so we really want to highlight the coloring it to the road to recovery and why I got vaccinated. And we all have different reasons for getting vaccinated. And it's I just like to thank the team members for being willing to share their reason and let us post their picture. I think it helps people who maybe are a little bit hesitant or unsure to have a better understanding of, you know, what their colleagues are thinking when they made that decision. So Crystal, for example, was hesitant, but after speaking with her doctor and watching the education sent out by the pharmacy, she felt that it was the right thing to do for her family, the seniors, and the world. So I'm going to stop sharing and find my notes again. Okay, and I'm going to share another one actually. So we also recognize that the rules around what you can and can't do if you're fully vaccinated is very confusing. It's been confusing for us, and so I trust that it's been confusing for all of us. So we've created a poster to help guide us through, and we will circulate this poster with the follow-up memo that goes out. Okay, so I hadn't figured out how to make this so that you can see it all at once, but immunized versus not immunized, what does this mean for you? So fully immunized, and I just want to highlight that fully immunized means you've had both doses if you're doing a 2-dose vaccine, and we don't have the 1-dose vaccine available to us here. So it's 2 doses plus 14 days. So if you're a DCP, you still need to be actively screened, have your surveillance testing, and wear your mask at all times, but you may be indoors 1 DCP at a time per visit. That still is the rule. I'm hopeful, and there's been advocacy that that will also be adapted and adjusted as we work through the stages. But for now, we did get confirmation from the province that that is not changing at this time. And so, or 2 people outside. You may have physical contact, including for non-care-related reasons, with a fully immunized resident. You do not need to wear your eye protection, and you may support in the dining room, and you may join in an activity. And general visitors need to follow all the screening, the masking, and the surveillance testing when we get to indoor visiting. And so you can have 2 visits outside. You can, under those special circumstances for that extended visit for the residents who aren't able to successfully do an outdoor visit, you can have that indoor visit, and you can have close contact with your fully immunized residents. So right now, that means you're a general visitor. It means you're outside for an outdoor visit, most probably, and you can do your screening, and you can hold your residents, your loved one's hand, which is really nice. And so if you're not immunized, or you're waiting for your 2nd dose, or you're in between that 14 days, you may be indoors with 1 visit. You're still with 1 visitor. You're still required to do the physical distancing when you're not providing direct care. However, brief hugs are still permitted. You must continue to wear your eye protection. And at this time, under these directives, you're unable to be in the dining room or join into an activity. Outside, for outdoor visits, it's still a max of 2 visitors. For those special circumstances, it's a maximum of 1 visitor. You would need to have eye protection if you were in one of those special circumstance visits. And you still need to have that physical distance for the visit. However, brief hugs are permitted. Our little disclaimer is that during an outbreak, none of this is permitted unless the resident is in an area unaffected by the outbreak. So I'm going to stop sharing again. Okay, and there we do have another little chart that it just is a chart form of that poster, and so we'll include that in the MailChimp update as well. There was something else about that I wanted to say, but maybe it'll come back to me. June is Seniors Month in Ontario, and this year's theme is Stay Safe, Active and Connected. And I'm so proud that this theme aligns with our Color It promise of person-centered care. And those 3 points were really the foundation of our approach throughout the pandemic. Residents, families, and staff have all been committed to finding new and innovative ways to stay safe, active, and connected. And we plan to highlight some of those stories throughout the month of June. I'd like to give a shout out to the Thornbury-Clarksburg Rotary Club, who led an initiative to partner with the Markdale Rotary Club, Hanover Rotary Club, and the Owen Sound Rotary Club to donate and install a beautiful sunshade at each of our care communities. Watch for a joint media release with some photos in the coming week. The teams in the homes have a lot of things planned to enjoy the outdoors and celebrate Father's Day and have some fun with some of our newfound freedom that vaccinations has brought us. I would be remiss if I didn't take the chance to acknowledge and thank all of the staff for their skill, their compassion, and their commitment to our Color It promise. Like you, we are all anticipating the end of the pandemic, and some of us are feeling the strain of the marathon. I've never run a marathon, and after using that analogy for over a year to describe the pandemic, I'm quite confident that I never will. However, throughout, there have been many examples of the strength, compassion, and passion of our residents, our staff, our family members, and our caregivers. So that was a lot of information. There's been a lot of updates. I thank you for your patience as we worked our way through it. I'd like to go to questions, and I'll echo Olivia and just welcome Denna. Denna is our clinical specialist supporting our 3 care communities, and she's going to help out with our Q&A. Please don't hesitate to ask a question. It's your questions that help us keep on the right track, and it ensures that we're communicating the information that's important to you. We know what information we feel is important and want to share, but your questions really help us make sure we're sharing useful, valuable information. So, Olivia.
Thank you very much, Jen. We do have a fair amount of questions, and if anybody did tune in a little bit later, I'll just remind them. We are primarily going to be looking at the Q&A feature in Zoom. It's at the bottom of your screen if you have a desktop or laptop, and it should be at the top of your screen if you are watching on your cell phone. Okay, so I will go through them and we will try to answer as many as possible without reviewing too many of them that are the same. So let's see how this goes. So the first one we have is listed as saying, we are both DCP and vaccinated. Can we take our mother out for a temporary absence, and what is the process?
Yes. So the good news is yes. Yes, you can. Under these directives, you can. The process, and this is where I'll make sure that Denna keeps me on track and I don't say, I don't get this wrong. So the process is to connect with the home and let them know what the outing is, when you're thinking of doing it, and the team at the home will just walk you through some kind of risk assessment questions, because there is still some risk, and we want to make sure that we've just kind of worked through what those options are. So going out overnight and to a house with 1 or 2 or 3 other people, and the status of their vaccinations and those kinds of things, is a different level of risk than going to, say, a patio to a restaurant and that's packed. So we'll just kind of work through those questions. If it's just a day trip, it's really just connect with the home and let them know. If it's kind of last minute, you still can pop in and talk to the screener, and they'll connect you with the right person in the home to say you want to go out for a drive and you want to get ice cream. This is what I would want to do. So I'm hoping my family is noting this. I would want to go out for a drive for ice cream if that's what you're doing, and then the team will help. If you're a DCP, you can do your process to come in the building and support your person to go out. If you're not a DCP, then you need to connect with the team, because they can then help bring your loved one out to you, and out you go. If it's overnight, there is a few more steps, and the the part about overnight is that when you return, according to the directives, there needs to be a PCR test completed and your resident needs to isolate until the results are returned. Dana, did I get that right for the overnight?
Yes, and if I could just even step back, so
Yep.
it's exciting that we can go out and outings, and yes, it's been a lot for the home, the care communities to absorb, and our staff to absorb with the new directives. And so some of our questions may still be sorting it out, but one of the things, it's definitely just keep those public health principles when you do go out for ice cream. You know, keep that masks, vaccinated or not at this time, because this is about the resident being fully vaccinated to go out for this absence. The masks should be kept on. And again, keep those public health principles, washing hands, watching the distance, and wearing the mask to support that. But I think we're working out the kinks, and we definitely are pretty excited to see residents and their families out and outings in a safe way. So, and as far as the overnight, yes, we are still working through that, but that one definitely requires a lot more connection with the family and services manager, and then they will connect too with the nurse on the floor, particularly for sorting out what we've done in the past with ensuring that the meds are in place, and still with outings, if depending upon how long the outing is. If it's going over a mealtime, we'll need to be aware of that too. So bear with us in this first little week. That we'll get more familiar. It's been a long time coming, so it's getting back into the swing of things.
Thank you very much for answering that. We do have another question related to DCPs. They're asking when both of them, it looks like it's a couple involved, would be allowed to visit their loved one at the same time in their room.
I wonder, Dana, do you have that in front of you? That's one email I didn't pull up.
About the DCPs in the room at the same time?
Yes.
Yeah, in terms of just a general visit, I mean, if we're in a particular spot where what we call a compassionate visit, that may be, we'd sort that out. But in terms of general visiting, not in the room at this time. That's what we heard in terms of stage 1 reopening. They're not at this time going to open that. It's on the radar to increase the 2 visitors, but not at this time. That doesn't mean that you can't do your visit outdoor. The 2 DCPs can be outdoor, but not indoor at this 2 DCPs at the same time. But I suspect it will be soon.
Yeah, I'll look back through my emails to see if I can find a timeline, but it's not coming to the top of my mind. So I don't think that we've been given any sort of timeline for that. It is on their radar. People have been, I know we have, and our colleagues have been sending that suggestion to the province.
Thank you very much. So we also have another question pertaining to booking of appointments. So I'm assuming that when it comes to visiting outside of the long-term care home, people might want to allow for their family members to visit restaurants and things like that. But this one is specific to hair appointments and styling appointments, and that would be when things might be opening up. I'm not sure if Jen, you want to just simply explain that.
Sure, and I read that question and was thinking that it was the maybe hair salon within the home, and so I'm gonna put a call out to the RFSMs if they happen to be listening and can text me. I know that I'm pretty sure that I read that the Rockwood Terrace hair salon is up and running, or perhaps that was foot care. So let's come back to that question if we can.
Okay. Yes, I think I read it a different way than Jen.
Okay, yeah, no, and maybe it is. Oh, see, they're so fast on they're so fast with their thumbs on the texting. So confirmed Rockwood, and Grey Gables hair salon is going strong, and I'm quite confident that I heard that about Lee Manor too, but I'll just confirm that whenever I hear back from those folks.
Okay.
In terms of booking for appointments outside, if it is in fact a hair appointment outside, I don't know that I paid attention to when personal services are opening in stage one.
Sorry, that
Stage two.
we haven't opened it up in the community at this time.
Yeah,
I think it may be even at presently it's at a much later stage than some of us could appreciate.
I know. I'm just giving up. It's just going to get longer. Soon I'll be sitting on it. But
we've definitely recognized that hairdressing is a really important part of the care community, and I'm really thrilled, you know, hearing around the province that Grey County Homes have been able to make that happen. So yeah, I think time to book it.
All right. We do have another question about, I'll just read it word for word for this one. If I want to take my loved one out on a day trip, who do I call to arrange this? Is it the nurse's station?
Yeah, I think that's a good start. The nurse's station, if it isn't the nurse, she'll be able to transfer you to the right person. So I think it could be the nurse's station, especially if it's after hours, and the resident family services manager and their team are also kind of supporting those special requests.
Okay. Another question has to do with bringing their loved one on a day trip. So bringing them to their house specifically.
Yep.
It simply is when would be the best time to do this, and when can they do this now?
So that was effective to yesterday. That day trip, so outings for reasons other than exceptional circumstances and medical appointments have now been expanded for social reasons as well. So absolutely can go for a trip to your house, and if anyone supported their resident to go out to a medical appointment or for an exceptional circumstance, it'll be this very similar process.
And I just wanted to add, for the social absences that we're talking about, the resident needs to be fully vaccinated. And it's great that our numbers are so high for resident vaccinations, and we are working with public health for any new residents coming in to ensure that we get the timeline. So again, those social outings heading away are for those residents that are fully vaccinated.
Okay, and a very similar question to vaccinations. Does a visitor need to provide proof of their second dose of a vaccine and dates when they were immunized when visiting the home? Is there a process that they need to fulfill to be able to do this?
I'm so glad that you asked that question. I was really hoping that someone would. There's been a different approach across the province, and I've been kind of hearing from different organizations and different homes are taking a different approach. Some are doing stickers and wristbands and all those kinds of things. And our approach throughout the entire pandemic, and I think that it's proven to be a good approach and a reasonable approach, is to assume that all of our team members and our visitors and our family members have only the best intentions and don't have any intention to bring any harm or infection or anything into the homes. So in the spirit of that, we are using an attestation approach. So very similar to the early days of testing before the province brought in kind of more stricter process. An attestation is all that will be required. So it's been added to the screening tool, which are those questions that you're asked when you first arrive. And the question will be for you to attest that you are fully immunized, and fully immunized is 2 vaccines and it's been more than 2 weeks. And then you will say yes, and we're going to take the honor system at this point.
Thank you very much. We do have a question about eye protection. Is eye protection still needed especially if you're not vaccinated?
So if you're not vaccinated, you are still required to wear eye protection. The only fully immunized caregivers, so DCPs is the language that we use, are permitted to remove their eye protection or not use eye protection. Eye protection is still required for team members, all staff, regardless of their immunization status, and for visitors and designated care partners who are not yet fully vaccinated must wear eye protection.
Okay. We have another question about protection. It reads simply that they are a DCP fully vaccinated. I must continue to wear a mask, but don't have to wear eye protection, but do I still have to wear a gown? So it seems like they want to know exactly what they're supposed to be wearing.
Sure. So you're right. I did leave that gown piece out of the update, so apologies. Okay, I know we need like a poster. So if you're fully vaccinated and you're a DCP, you need to wear a mask, and you need to do hand hygiene, and you need to screen in and do your rapid antigen testing, and then you are good to go. You do not need to wear eye protection, and you do not need to wear a gown. So we use the gowns, and we implemented gowns in the early days of the pandemic when there was still very little understanding and science around exactly how COVID-19 was transmitted. Now we are much more confident, and there's evidence to indicate that the transmission through fomites, so here's where I use words that I'm not formally trained to use, is very low. So that ability to transmit from touching something and on your clothing, it's very, very low. And so I think it's good news that we are not needing to use the gowns anymore, especially as we head into the warmer season. And so no gown.
And, obviously you can get a theme here that if you're fully vaccinated, you have to wear less things. So I think if you're not quite there yet, making sure you have the eye protection and your mask. Obviously hand hygiene is throughout it, but yeah, we're certainly hoping we'll get to a place where we won't also have to wear masks. But for now, mask is universal, whether you're in our Grey County care communities or whether you're out in your town. So masks and we'll maintain at this time.
Now to something a little bit more exciting. Some people like to bring treats and snacks for family members into the home, and that normally was a regular occurrence of bringing cookies or whatnot. So there are a few questions pertaining to providing snacks or treats. Would you be able to provide some information about that? Bringing in treats to the loved ones in our long-term care homes.
Sure. So I was just looking to see, because I think there's a couple of questions. Just wondering if maybe you could be a bit more specific. So I see one about DCPs are not allowed snacks in the home, but are we allowed to bring a container of drinking water so we don't get dehydrated? Absolutely, and most definitely. And you can bring yourself a snack. You just can't eat it together with your resident at this point. So you can bring in a favorite drink or an ice cream or a treat for your resident when you come to see them as a DCP. And you can bring yourself a drink and a snack. You just can't eat them together. And I'm fairly confident that each long-term care home has a dedicated space for DCPs to be able to go and have a drink and have something to eat. Because some people are coming and spending, several hours. So we don't want any heat stroke or dehydration or fainting spells from hunger. So yeah, you can bring a snack, and if you're not sure where that is, just check in with the Resident Family Services team.
And it's definitely this heat wave this week. And just as a reminder, when you do take your mask down, you take your your drink and you put your mask back up. That's another opportunity for hand hygiene. So we have a lot of the alcohol hand rubs around there, but if you are out and about, and I'm sure people have some pocket hand sanitizers, but definitely every time you touch your mask, have your drink, have your snack, because then you're hopefully still hand holding.
And I'll just add, I see another question. As a DCP, why can you not have a treat together when at the same time you could go home and have a treat together? And it's a very good point. And I think a few times along the way, we haven't always been able to rationalize all the rules. We do need to operationalize them and we do need to follow them. So unfortunately, at this point, you can't eat together. I do know that I get what you're saying. You can go home and eat together. And again, it's important that we do a risk assessment. So if it's the two of you at home, you're both fully vaccinated and you share a meal, the risk is different than if you were to go to a busy patio and not have a sense of who's vaccinated and who isn't. And at the same time, we have to hold a standard that the ministry sets for us. And so that standard is, at this time, we can't eat together. So I know it's disappointing.
Okay, I'm going to read this one word for word. It's a little bit longer. As a DCP, fully vaccinated, visiting my parents who have mobility problems, would my husband, who is one-shot vaccinated, allowed to go to Rockwood Inner Courtyard to visit as well, or only outside? Would he be allowed to help move them to the courtyard, or would he not be allowed to go to their room?
That sounds like a good question to give Terry a call and just work through, Terry and Lucinda, and just work through the details. And I think I'm confident we can find some solution that meets the rules and still supports a visit. So give Terry and Lucinda a call and we'll go from there.
Okay. Another item, how is it, okay, so talking about visiting a home. So how is it I can take mom out with my wife and who is a DCP and fully vaccinated, but only one can come in the home?
Yeah, and I agree. And this goes back to the challenge of us needing to meet the standard that's set by the Ministry of Long-Term Care. And I think we've seen this along the way, that sometimes it takes a little bit of time for the standards to align and maybe make all the sense that we're hoping that they'll make. So, and I'm confident that this is how it's going to be over the next few months, is there's going to be a change and a shift in the restrictions and the requirements. And we're going to have a period of operationalizing it and getting used to it, and a chance to provide feedback to the Ministry of Long-Term Care. And they have been responsive. They do make adjustments. So I think that's really promising. When a new directive comes out and it doesn't really align with some of the maybe conflicts or contradicts some of the other restrictions, we give that feedback through our association, which is Advantage Ontario, and also directly to the Ministry of Long-Term Care. And we will see within a week or two, they make, sometimes it's a little longer, they do make changes to the directives. So we'll pass this feedback back to the province and advocate for making some expansion with the two DCPs, most are fully vaccinated. All are well trained in our policies and our IPAC strategies. So we'll advocate for that. I hear your concern and I will pass it on.
Something we have reviewed already, but it has to do with a foot care. So is foot care taking place? We did mention hair care,
Yes.
but just to clarify, is foot care taking place?
Yes, I'm going to say yes. I'm going to wait. I'm going to wait for my phone to tell me otherwise.
And in
And-
terms of foot care, we're talking
Yes.
about the registered provider
Yes.
of foot care, because presently the province does not open up sort of that more personal service setting kind of foot care like a pedicure. So the only one allowed in the province is essential registered practitioners to provide foot care. And I do believe in consult
Yes.
some of the teams that
Yes,
they are.
They have, yes.
Yeah, those essential. We've done some. We do that assessment. We screen that foot care provider that's coming in, and also many of them are also doubly vaccinated, fully vaccinated.
Again, pertaining to personal care, we have someone explaining that Rockwood has a hair salon. I'm not sure if this is a staff member that has chimed in. They're noting specific days. Jen, if you'd like to clarify that, or if people have any questions that they would like answered, or if they'd like to email communications at gray.ca, we will be forwarding those on to long-term care to answer these questions, or you can reply to the long-term care newsletter. Any information that you might need, we will be able to provide that back to you. So this might have to do with hair salons within the long-term care homes. Jen, I'm not sure if you want to add anything to that.
Sure, I'll just confirm that it's Wednesday and Thursday for hairdressing at Rockwood. And thanks, Janice, for putting that note in the question box. And I wondered, Olivia, if I could answer. I see a question, and I don't know if I'm using Zoom correctly, but I've marked that I'd be happy to answer it live. Do you mind if I go ahead and do that?
Yeah, go right ahead.
Okay, there's a question. Can you provide an update on how staff are updated on changes? We arrived on June 9th, and clearly staff have not been trained on changes, which creates confusion. So thank you for asking that question, and because it does give me a chance to acknowledge that it has been very confusing. So even with the questions that we've had today, and it's June 10th, and I'm pretty sure we found out about the bulk of the changes on June 5th, which doesn't give us a lot of time to not just put the structures in place, but also get it communicated. The 3 care communities have 500 employees. So it takes a bit of time to get that information, not to say that we shouldn't. And so we work really hard at that. So we have a variety of different approaches to communicate this information. So we do huddles. With teams and small groups, and small groups because it's COVID. We upload memos with attachments of the information, so we post it for staff. We have a central digital communication board, and we post that information there. And it's really through the huddles, though, and a bit of time going by where we get to better understand where the confusion is, and then we adapt our communication. So it was pretty clear pretty quickly around June 9th that we needed to create those posters and the charts. And so now we've created a chart and a couple of versions of that poster that I shared, just to make it a little bit easier for the screeners to keep track of all the changes. So I appreciate that it's really frustrating, especially when you've been waiting so long to be able to come in and have these visits and enjoy some of these changes. So I appreciate how frustrating it is. And I also appreciate your patience as we work our way through it. And if you have some other suggestions, happy to, we're always learning about how we can do better.
Thank you very much for answering that, Jen. We have another question speaking about timeframes. So what timeframe is there for when DCPs are able to visit together? I believe we might have mentioned it before, but we can go ahead and explain.
Yeah, sure. So the province hasn't given us a time frame. What they did was clarify that inside, it is still one DCP visit per resident at a time. So they clarified that. They did not indicate that that would be changing in the near future.
Okay. We also have one about swabbing. So I believe it's more the tests. Do I need to be swabbed to take my loved one out to an appointment or a social outing? There might be some clarification needed, I'm assuming, but we can answer that
I don't
one.
mind answering this one because it has slightly changed, because if you'll recall, when we opened up outdoor visits, people had to come into the home, do the screening, get swabbed, and then go back out. The new direction is that if you are not coming into the home, you are not required to be swabbed. So that is our condition at this time. Now, some people may come in there. If you are a DCP and you're coming in to go upstairs to get your loved one, we still have to follow that process of being swabbed. But if you are meeting and not coming into the home, that the swab is not required at this time. Jen, any other clarifying points?
No, I think you covered it. And I was just going to type back a response to another question that is kind of along this lines and just around the communication challenges. There's still people struggling that there's not clear communication on the process. And when they call the home, they have up to 4 different staff members giving different answers without clear direction, for example, around that temporary travel away from home. So I was just going to type back. Thanks very much for that feedback. I think what we'll do, I know what we'll do is create a checklist, a bit of a process map, and provide that to all the staff members, in particular, the screening staff and the registered staff who are going to be, and the program staff who are going to be answering the phone when those requests come in. And we'll clearly outline that this is the process if someone wants to do a social outing. This is the process, the steps very clearly if you want to do an overnight. So the steps will be similar. There will be specific questions around what the outing is about that are around risk. And so the answers to the questions in that, are you going to a restaurant patio, which isn't an automatic no, by the way, it's just there'll be a different discussion about the risks and the strategies to go to a restaurant patio. And then here's the risks and the strategies going to a home with one other person who's fully vaccinated. So we'll create a very clear step-by-step list that can be provided to people when they call. So thank you for that feedback.
Yeah, and if I may, Jen, too, like each day that we've gone through and worked through, we've answered a lot of questions. So certainly by today was a little smoother, and tomorrow, as we build that familiarity, it is becoming a lot more understood. But it's also, we've been in a place where we have really put a lot of caution. And so even if we have it out there, there's still a lot of back and forth and questioning. So we may have communicated it, but there's certainly some things there that nobody wants to do the wrong thing. And so they want you to be with your loved one, but we've also put so many conditions in. It's really quite a process for us to back off a little in this road to recovery. So it may be we've communicated it, and we definitely have checklists. We have the screeners go through things. We got their feedback on whether it made sense before we sent it out. But I think there's also some of that where it's letting a lot go when we've been so cautious to protect residents in our care.
I know that you're right. And so our caution, like, it's hard to go from so risk adverse, which we absolutely had to be, to make sure that we were keeping everybody safe, the residents, the DCPs, our team members. And it is a big change to go from so risk adverse and so worried all the time to being a little less worried and more moving in this direction. So we want to, and I think you're right, Dana, it's just no one wants to do the wrong thing and put somebody at risk by accident. So thank you for highlighting that. There was also a question about why. So I think we misunderstood the question around eye protection. So maybe why don't the DCPs have to wear eye protection? Did the province give us any of that feedback when they gave us that
we're
update?
dealing with a couple of things when we're taking a look at the eye protection. So obviously the reason we were wearing eye protection is because the potential of it being a mucous membrane, the virus, right, and any sort of concerns there. When DCPs and general visitors are fully vaccinated, there is not the need for that. Staff members are under a different, as employees, it's occupational health and safety legislation. It's also, through the requirement of the Ministry of Labor that based on the risk assessment at this time, that we are still required to wear those eye protection. It's absolutely in discussion at the moment. Jeff Butler said that we are looking at it, but again, we want to ensure that we are protecting our staff, and we have that requirement as employers, and through the Ministry of Labor has given us that exact direction, as well as Public Health Ontario has made that recommendation for our staff as well. So until such time as they come and alter that, we will maintain the eye protection for our staff, that even regardless of whether our staff are fully vaccinated at this time.
The only thing I'll add is that if you want to wear your eye protection, you absolutely can. So it's just if you don't want, if you choose not to, you are able to make that choice if you're fully vaccinated. If you wish to continue, then that is absolutely available to you.
And some people were commenting that they kind of feel a little naked without it. We've wearing it for so long that, you head into the grocery store and you're like, where is it? But yeah, we'll absolutely provide that for you, and you are more than welcome to use that protection.
I saw a note, Olivia, in the chat about that somebody got both of their shots at Lee Manor. Would Lee Manor have it on file? And so we will have perhaps it written down in a list, that because we're tracking DCPs that have had their vaccines, and staff and residents. However, the province will have sent an email with a kind of a formal notice saying that you received your vaccine, which type it was, and the date. So if you need some support sourcing that, let us know. We can help you out.
And I also heard, Jen, that people can go in through there's a COVAX website that you can print your report. So as soon as we get more of that information, I think that's going to get published to the general public as well, so that they're not calling where they, whether it was their doctor's office, they can go to a website and they're just working that through, so you can print a report. That might be in line of getting these vaccine passports or demonstrating it. So I think it's soon to come.
Okay, we do have a question about how often a DCP may take their loved one out in a week. So obviously people are excited to see.
Yeah, there's no limit dictated in the directives. So there's no limit. So we're making baby steps to getting back to some sort of normal. And I typed back a response and then it disappeared to a question. So someone just noted that we missed updating a section of the DCP policy to highlight that it's still only one person, one DCP at a time versus two. And so thanks for that, and we will fix that up.
I think what we did with most of the other ones is number based on the current, because it was changing, but thank you. We're working on those tomorrow.
Yeah.
To finish, finalize.
As of right now, it doesn't look like we have any more questions. We are right at the 7:59 mark. We were going to stop at 8 o'clock. It looks like there's a couple more questions popping in. We can review these two questions, and we'll see how Jen and Dana are feeling. Okay.
Yeah, no, sure. I'm happy to do that.
Okay.
Oh, you're muted, Olivia.
Oh, thank you. The first one is pertaining to dose administration receipts. It looks like this is specific to both of you dealing with emails and receiving documentation.
I think that he's just sharing, if you're looking your email, and it'll be in the send file if you're looking for your vaccine receipt. So if people are wondering, go back to your email and it says dose administration receipt. I recall seeing mine too. And you can do a search in your email if you're looking for your last dose.
I see. That was speaking about when people were receiving their vaccinations. Okay. We have another one. We have only been allowed to come once a day as DCPs. So once we leave, we can't come back for 24 hours. Has that changed? So we can pop in a couple different times a day.
That's a really good question. I'm gonna have to check back on that. I'm not confident that we're limiting, but perhaps we have been limiting. So to that 24 hours. So I think that really has relaxed. So Janice, if you can maybe zip me an email or to Olivia and she'll get it to me, but either, so jennifer.cornell@gray.ca, and I'll just touch base and get a little bit more information. So I do remember in the early days that there were very strict limitations and restrictions on how often and how long a DCP could be on site. And that has relaxed along the way. And so I just want to get a little bit more info from you, and that way I can make sure that if this is perhaps a misunderstanding, we can clarify it, and maybe you're not the only one that is feeling this way. So that'll be great.
Okay. And as of right now, we have no more questions. If anybody wishes to connect with Jen or long-term care, there is an email newsletter that always comes out. You can reply to that, or you can send an email as Jen gave her own email out, just jennifer.cornell@gray.ca. The main thing is that they're always open to answering your questions so that you understand what's going on in the long-term care home for Grey County. So I think that we are going to wrap up now. If anyone has anything else that they'd like to say before we close down the webinar, the call today, we do have one more question if we'd like to take the time to answer that. It's very quick.
Okay, so when we take our loved one out, we can't have them visit with others, correct? So we are still, I think really the rule of thumb would be to follow the provincial guidelines. So if you're going out to, off the property, then the step one, phase one guidelines should be what you follow. And I think that would keep us almost safe. And if you have specific questions, then do touch base with the team, and we can do a bit of a risk assessment and see where it is, where you're going and what you're doing. So thank you for that question. So I would just like to say, to wrap up, I said this at the end of the March meeting, and I really still think it applies. So it is Seniors Month, and I urge each of you to take a few moments to reflect on your experience over during the pandemic. Take some time to notice and appreciate the impact you've had in the most challenging times. And I want to thank you again for your ongoing support and active participation in our pandemic planning and response, and now in our recovery. Thank you for being flexible and understanding, and also for being advocates for your loved one and for us in long-term care. I think we can all be proud of how we've worked together with the clear goal of prioritizing our health, safety, and wellness of our residents and our communities. And we couldn't have done it without you, and we still can't. So thank you for being so engaged, and have a wonderful, it's a beautiful evening. Have a wonderful evening.
Thank you,
And thank
everyone.
you, Jenna and Olivia.
Thank you, everyone. We're going to be closing down now. Have a great evening.